In today's health headlines, the benefits of one long walk per day. Could the COVID vaccine help cure cancer? And what your grip strength might say about your overall health. Joining us this morning, Dr. F. Perry Wilson, Associate Professor at Yale School of Medicine, Yale Medicine physician, and the author of How Medicine Works and When It Doesn't. Dr. Wilson, thank you as always for being here with us. Now, research has found that one long walk to get all those steps in is better for your heart than several shorter walks during the day. Why in the world is that the case?
Yeah, it's a very interesting study out of England that looked at more than 30,000 older adults who did not regularly achieve that 10,000 steps a day number that so many of us are keeping track of. And they linked the number of their steps, but also how long they spent taking those steps to outcomes like heart attack and stroke. And what they found was that sure, more steps are better, but even accounting for the number of steps you take, putting all those steps together in one longer walk, and they used at least 15 minutes as opposed to multiple shorter walks, seemed to improve the cardiovascular outcomes. And it's probably because it takes a few minutes for your heart rate to get up and for your blood pressure to sort of be affected by that extra bit of exercise. And so if you can, find some time to take a slightly longer walk, probably better for you.
Very interesting, doctor. Okay, scientists have learned that the COVID vaccine may actually have another use to actually help cure cancer. What can you tell us about that?
Wild study appearing in the journal Nature came out, which looked at patients with lung cancer who were getting immunotherapy. These are these breakthrough therapies that turn the immune system against the cancer. What they found was that if they also got the COVID vaccine, an RNA vaccine, their risk of death from that cancer was cut in half. I mean, just a huge effect. They hypothesized that that RNA in the COVID vaccine is revving up the immune system even further, which in combination with the immune therapies that those patients were already getting allowed the immune system to fight and kill off that cancer. Turns out it doesn't matter if it is the COVID RNA vaccine, but it does have to be an RNA vaccine. They tested that in some mice. So the flu vaccine, pneumonia vaccines, which are not RNA-based, don't seem to have that immune stimulating effect. So if you do get the COVID vaccine and you feel those immune effects the next day, you're feeling a little feverish, you're feeling a little achy, well, it's working.
Okay. Doctor, I love this one because I can never get my body mass index where I want it to be. But there's a new study out here that says instead of body mass index, a person's grip strength might actually be a better indicator of overall health. How exactly was something like that determined?
So this is sort of a perennial problem in medicine, is that BMI just takes account of height and weight. And there's a lot of ways to get to a certain weight. Muscle is denser than fat. Muscle weighs more than fat. And of course, muscle is very good for you and fat isn't. So scientists have been looking for other ways. This was another large study that utilized the UK Biobank, tens of thousands of people, and they found that grip strength, using a standard tool, it's not just how hard you shake someone's hand, but your actual grip strength was a much better predictor of body composition, including the muscle to fat ratio, than straight up BMI. So it's easy enough to do, and something that predicts greater longevity.
All right, very interesting. Dr. Wilson, great seeing you as always.